Well, hello. Hello, everyone. Welcome to Your Health in Your Hands. I am Dr. David Ajibade with the Brain and Body Foundation. And as our tradition is, we're going to keep on bringing to you important, pertinent information about what's going on in Nigeria, what's going on around the world, and what you need to know to keep yourself and your family safe. On our show, on the, I can't say in the studio because we're not in the same place, but in the show today, we have someone you've known. We've had her on before, and she's coming back to give us a really good update on the things that have changed. So without further ado, Dr. Mercy Edionwe, welcome to the show.
Hello, hi everyone. Thank you so much for inviting me, Dr. Ajibade. Happy to be here.
You're welcome. Happy to have you. So it's been quite a few months. I would say about, is it 4 or 5 months since we last had you do your thing, tell us about what's going on and all that. And since then, a couple of things have changed. We have a new president. We've had ups and downs with the COVID-19. And then we now have a vaccination. We have about 3, right?
Correct.
Good. So we're going to talk about the things that have changed since that time, and the good and the bad, obviously. And then also want to talk about long haulers, because we're now beginning to see patterns, right? Over the last time we started, the whole thing with COVID-19 started about when it really started was it January 2020 or was it December? When was it in the US?
Well, in the US, I want to say it really started maybe in March of last year. That's when we started seeing, just cases just kind of concentrated in certain areas of the country. But yes, that's kind of what I
right. So you had been hearing stories about the retirement homes and things going on in Washington, some in New York and all that, but it hadn't really trickled down to Texas yet.
Right. Yes.
So March was when it really started picking up.
Yes. Yeah, for Texas, correct.
For Texas, right. And then ups and downs. So tell what's been going on. Bring us up to speed.
Well, thank you. Okay, so as you said, a lot has been going on in all different fronts when it comes to COVID. From the hospital side and the hospital management of COVID, we're noticing that we're getting a grip on the different treatments that we can use for our COVID patients, and we're seeing positive results. So a lot of our patients that come in, they're initially afraid, and we're now able to reassure them that they do have a fighting chance. Like I'd said in the last interview that we had, some of the treatments that we're using, such as remdesivir, steroids, they have had an effect on the patients. So we're more reassured that we can handle the management of COVID. Not to say that we're not seeing these severe cases, because we are we are seeing these severe cases, but the majority of patients who are hospitalized, we're seeing they're able to go home safely. And so from that angle of things, I am happy about. Also, as you said, we're now seeing the massive disbursements of vaccinations. Here in the US, we do have 3. We have the Pfizer, we have the Moderna, and we now have the Johnson & Johnson. And as you guys are aware, the Pfizer and the Moderna requires 2 shots, whereas the Johnson & Johnson requires 1. And I believe in Nigeria, they're now having the rollout of the AstraZeneca vaccine.
Right.
So it's great that, the vaccines are now being dispersed into the communities.
Is there any reason why America isn't using the AstraZeneca as well?
They do have it in stock. I am aware that they do have it in stock. I'm not quite sure why they have not dispersed it. But it is in stock, ready for use. I do know that they have been selling some of their stocks to Mexico. So I do know that aspects of things, but why it has not been dispersed to the general population, that I do not know.
Okay, okay. And we were talking about treatments, and that's great that you've gotten a better handle on it, and we're getting better clinical outcomes. So, which means that the ICUs, the emergency rooms, are not being overwhelmed anymore. Is that correct?
Exactly. Great observation, Dr. Ajibade. I remember around, I want to say June, July of last year, I would look at the roster from the emergency room, just the patient rosters, to see who's coming in. And a lot of times it was COVID, COVID confirmed, COVID confirmed. When they say COVID confirmed, that means that they've done the testing on that individual patient that's in that room and they've tested positive. And so it was just like, you know, at least more than 50% of the patients that were coming into the emergency room, they had COVID. But now I've been seeing maybe it's shorn down to 10% or even less. And so it has really freed the capacities that the hospitals have when it comes to treating COVID patients, as well as other diseases and their severities.
Nice, nice. And folks, for those of you who are meeting Dr. Edionwe for the first time, she is an internal medicine physician who is a nocturnist.
Yes.
Which is, remind us what that means.
A nocturnist is a night doctor, a nighttime doctor. So I work the night shift. And essentially, as a hospitalist, what that means is when you go to the hospital, you go into the emergency room, you're seen by emergency medicine physicians. Well, when the emergency medicine physicians feel like your illness or condition is severe enough that it requires hospitalization, they call me, and that's when I take over your care and I start to treat you while you're here in the hospital. So I'm the person who admits you into the hospital for you to be hospitalized. So I've been dealing with COVID patients since the onset of COVID here in the United States.
Wow, so you must have a lot of experience with COVID-19 patients. So yes, tell us, frankly, we were talking around this time last year, or maybe later, there was a lot of noise about hydroxychloroquine, and then eventually it became, or it has become ivermectin, which are alternatives to the standard treatments. What is your take seriously on those? Have you tried them in the wards? Have there been any responses from doing that in the wards?
Well, I have not tried ivermectin, so I cannot speak on that, but I have tried the hydrochloroquine. In fact, in the beginning of the COVID pandemic, that was the treatment of choice for anybody who came in. And this is an anecdotal evidence, but from what I saw, those who we gave hydrochloroquine, they did not do well. They did not improve as what was supposed to be touted as this treatment for COVID. It got to the point where, as a result of it, our hospital system, meaning all the hospitals that are have a relationship with each other, made a huge decision to decide to stop using hydrochloroquine. So for us, it didn't work. But I do know that other physicians, especially outpatient physicians, they have said that they noticed that there is some sort of benefit. And it may be due to severity. It may be that the mild cases, there is a benefit, but when you go to moderate, severe case, which requires hospitalization, it's not as effective. So there's a lot that is, that is needed to be investigated, but that's my experience.
And that makes sense. And I know when it was being touted, it was touted as a treatment for the milder cases to prevent them from becoming the more severe cases in the hospital. But that's good. That's good to have that kind of insight as to what is actually happening in the hospital. So thank you for that insight. Nope. We're going to take a quick break now, folks, and we will be right back. Stay tuned. All right, welcome back, folks. We are with Dr. Edionwe, Mercy Edionwe, who is a nocturnist, an internal medicine physician based in Texas. And we are going to be talking about vaccines and some of the interesting findings, shall we say, that you've been seeing you've been having with people who are on the vaccine? Tell us about it.
Well, the interesting findings that for people who are on the vaccine, what we've been seeing for the most part is a majority of people who do take the vaccine, they have very minor effects. I took the vaccine, okay? I can tell you that I took the Pfizer vaccine, and for the most part, what I experienced was the first dose, I experienced muscle aches, and it kind of went away after like 6 to 8 hours. And then the second dose, yeah, was a little bit more effects that I experienced. I had a little bit of a headache. The muscle aches were a little bit more diffused, but within 24 hours, I saw resolution. So for the majority of the people that I have been interviewing or we've been talking about the COVID vaccines, they have minimal to no symptoms whatsoever.
Good. Really good.
But go ahead.
Yeah, that's reassuring.
Yes. But there are some cases in which people are experiencing some side effects, if you will. And I know for some of the vaccinations that were here in the US, people were talking about having allergic reactions to them. They were talking about, having perhaps even developing flu-like symptoms, which I want to also point out that that's very common to have these type of effects after any vaccination. So it's not really specific to COVID. I can tell you that a lot of these companies are looking very closely to all these side effects. And I can say firsthand that when I took my vaccination, they had this text messaging system where they would text you every day and ask you, what are your symptoms? And they did it for months. This was under the CDC. So they definitely are looking closely to a lot of these symptoms. But like I said, the most part, there isn't any major side effects. What I tell my patients is if you have symptoms beyond 48 hours, I would seek the assistance of a health professional, a physician, who can look more into why you're having these symptoms.
Okay. Now, that's run of the mill stuff. We get it. Most people who have a vaccine will have issues with it. Tell us about some of the things that you and I discussed that have to do with some of your patients who you've seen who have had vaccines, and do they still get the infected? Tell us the interesting stuff, Dr. Mercy. Tell us the interesting stuff, please.
Oh, great. So thank you for that. So that's the thing. So a lot of people have this misconception that although I get the COVID vaccine, that, oh my gosh, I will never get the COVID. And the vaccines, they help to reduce your risk of getting COVID, but it does not completely reduce it. So you do still have a chance of getting the COVID. The only thing that the vaccines help you do is reduce your risk. But in addition is if you have COVID, it reduces the severity of what symptoms you experience. So Dr. Ajibade is referring to a couple of cases that I spoke to him offline that perplexed me. In the beginning, when we started giving the vaccines to the frontline heroes, so those who have high risk of COVID exposure, the US government decided to start giving the vaccines to those people, including healthcare professionals, firefighters, grocery store workers, things of that nature. So I had a patient who was a firefighter who came in. He had the vaccine, but he ended up developing COVID. The perplexing thing to me is I was astonished because yes, he had COVID, but he didn't require any oxygenation. And a lot of people who come in, they come in because they when I say come in, meaning get admitted, they get admitted because they are having trouble with breathing. That's the number one cause, and they require oxygenation. For some reason, even though his numbers, meaning his labs, showed that he may have a moderate mild to moderate case of COVID requiring closely monitoring, he did not require oxygen whatsoever. So we were just admitting him just to observe and hope that his case does not progress. That was one case. The other case that I had was this 90-year-old lady.
Just a minute. So under normal circumstances, with those same numbers, you would have given him oxygen. You would have given him.
So under normal circumstances, with the abnormal labs that he had last year around this time, you would have seen a lot more effects from the COVID. So some of his organs were impaired by the COVID virus, but his oxygen, meaning his lungs, was not as impaired as some of his other findings. I'm trying not to get too technical. So it was weird because he met the criteria of maybe moderate COVID. But when you're at that stage of moderate COVID, one of the things we were always seeing is that your oxygenation gets affected. But for him, his oxygenation did not get affected. In fact, I think the reason why he met the criteria was because he was dehydrated. He had symptoms of nausea and vomiting, so he wasn't eating and drinking. And so we were seeing more the after effects of, some of the milder symptoms. Of course, if you're not eating and drinking and you're vomiting, your numbers are going to look a little bit different than if you're well hydrated. Right. So we were seeing those effects rather than what we thought we would be seeing, which was him needing oxygen, because to us, the numbers looked like that would be something that he would be experiencing. Okay. That's kind of the way I would describe that.
That makes sense. So the numbers were bad, but the oxygen levels were still okay. So yeah. Okay, got it. All right. So you're talking about the 90-year-old grandmother?
Yeah. So the 90-year-old grandmother, she had gotten the vaccine. So just to backtrack, after the frontline heroes, or during this first stage of when they were rolling out the vaccines, they were not only giving it to those who were working in the front line, but they were also giving it to older population. So she met that criteria to get the vaccine during the first stage. And so she came in, she was having headache, malaise, a fever. So when I say headache, malaise meaning muscle aches, she was having a fever. And so we tested her. She was having the sniffles, a sore throat. We tested her, she was positive. So we're like, whoa, okay, this is a 90-year-old who's positive for COVID. She even had, and I have to show you, she even had a suggestion on her x-ray of having the COVID pneumonia. But she didn't need oxygen. So this baffled us, at least me, because here you are, she has a very high morbidity, high risk. She is in her 90s. Our x-ray showed that she has some evidence of COVID pneumonia, but she's not requiring oxygen. So we typically, if she was maybe in her 20s or early 30s, we'd probably say, we'll serve you one day or so just to make sure and let you go home. But for her, we just kind of observed her even longer because she met that criteria of being in the elderly population. But throughout her stay, she didn't need oxygen. So I'm seeing cases like that is making me think that this vaccine is doing its job and reducing the severity of the types of cases we are admitting into the hospital.
So people still need to be careful. However, vaccines do confer a certain level of protection.
Yes.
But no deaths so far from amongst those who have had the vaccine but who still contracted COVID-19. Have there been any reported deaths from COVID-19?
Not that I'm aware of. I'm pretty sure if there was, it would be on the news or at least in the medical journals that I read. So I haven't heard of any.
Okay. Another question. Are you sure it was just COVID-19? Could it possibly have been something else, like the flu, for instance?
No, typically and that's a good question. Typically with these type of patients, we do test for the flu. We test for Legionella, which is a type of organism that can cause pneumonia. We test for Streptococcus pneumonia. So we do a battery of tests to ensure, because sometimes, in great point, Dr. Ajibade, even though you do have COVID, that does not mean that that inhibits you from having another infection along with the COVID. So we're very careful to make sure that, we're only dealing with COVID when you are admitted to the hospital.
Awesome, perfect. All right, folks, we're going to take a quick break. We'll be right back to talk about long haulers. Stay tuned. I'm gonna have to do it again.
Okay.
Okay, so you got, I beg, just cut out the part where she's playing with her hair, Yinka. All right, we're getting back into it. All right, welcome back to our third and final segment. And we want to talk about, we don't want to end this show without talking about long haulers. So long haulers, what does that mean, and of what significance is it, Dr. Edionwe?
Yes, thank you. So typically when you have COVID, just to give a recap, you have symptoms such as a headache, you have fevers and chills, you have a sore throat, you have a cough, you have maybe some chest tenderness, you have some muscle aches, some people complain of diarrhea. Of course, you feel tired and weak. And some people complain of not wanting to eat, loss of taste, loss of smell. So those are just the primary symptoms that you have when you have COVID. And for the most part, when you get the viral infection, it should resolve anywhere from 2 to 3 weeks. And this is with or without treatment. Now, when these symptoms persist beyond 3 weeks, that's when we start calling your symptoms, or we would start calling people who have these symptoms COVID long haulers, or we say the long COVID syndrome.
Yeah.
Go ahead.
I'm listening. I was just saying, okay, just following along.
Okay, so again, it could be maybe you in the beginning you were having the fevers and chills and the cough, the loss of taste and smell, but after 3 weeks, your residual symptoms are still the loss of taste and smell, or you're still having persistent fevers or chills, or you're just having this brain fog where you're feeling confused and you're normal. These are symptoms of, like I said, the long COVID haulers, or the long COVID syndrome. And for right now, because COVID is so new to the world, and this type of condition, the long haulers condition, is such a new thing, scientists are taking a look at it and seeing what the implications mean.
Right. So, I mean, I watched this. I have a patient of mine too, way back in Nigeria too. I mean, he had a mild form like you described, and this is like 6 months, 7 months later, and he's still having to deal with the issues and everything from, like you said, brain fog, fatigue, pains, aches and pains, headaches. And that's really, really, shall we say, disturbing. It's distressing, because these are people in their prime. I watched, and it seems to happen among the younger, correct me if I'm wrong, but it seems to happen among the younger age group, not the 60s and above, but the younger ones who are, so to speak, healthy and active.
Correct.
I actually watched a 60-minute show with Anderson Cooper, and they highlighted 2 ladies, Black ladies, who one was a marathon runner, the other one owns and runs a gym. So they are healthy people. Mm-hmm. They are now dealing with major effects, long haul effects, and the things we've described, including neurological conditions. Some of them are lack of balance, and they're losing the balance, they're having difficulty walking, getting up from bed, they're finding it difficult. I mean, these are terrible, terrible symptoms. And many times the doctor just says, well, we can't see anything on the CT scans or the MRI or even a blood test, and you just send them home. It's all in your head. You're fine. This needs to we need to get a handle on this thing. Is there any breakthrough where long haul is concerned, or do we just ask them just write it out?
So we are seeing some interesting cases. Again, getting back to what you said, I so totally wholeheartedly agree. They have been noticing that there has been a predisposition of people who have COVID long haulers within the younger population and within women. So they are noticing that. But what they're also noticing is those who get the vaccine have had a reduce of their symptoms. So this is something that's still being investigated, but this is a new finding that getting the vaccination has helped people improve. And so that's something to look out for.
That's good. That's certainly good news. And you said you had some information for those of us in Nigeria who may want to get the vaccine?
Oh, yes. It looks like the National Primary Healthcare Development Agency, a part of the government, they have actually set up a website. It's called the nphcda.gov.ng. This is a website where you can register to get the vaccination. So you just fill out your information, your location, and they will direct you either via email, or text message of the local sites where you can get your vaccination. So again, it is the nphcda.gov.ng.
Awesome. Thank you. So those of you guys who want to get your vaccine, you can go there and find out how to get it sharp. All right. Well, thank you for that, Doc. So we're in the twilight minutes period of this time. Any final last words?
Well, I mean, I just want to encourage everyone that, compared to last year of this time, there is a lot more positive developments when it comes to handling COVID and when it comes to preventing COVID. I also want to emphasize, just because you have the vaccination doesn't mean that you shouldn't still social distance. The 6 feet away is still holds true, especially when you're in large gatherings. Doesn't mean you shouldn't wear the mask. You should still wear the mask because you can still get COVID. Although you have a lower risk, you still can get it. But I want to encourage everyone that this too shall pass. And so, we're all in it together. Thank you so much, Dr. Ajibade, for letting me speak.
Awesome. Thank you so much, Doc. Appreciate your time. And folks, remember, stay safe. And you can always watch these videos on our website, brainandbodyfoundation.org. And of course, the NTA website. And of course, these videos are now being aired live online. So anywhere in the world, that's pretty cool. You can watch these videos. Again, God bless, stay safe, and see you next week.